Good morning, Chairman Lips, Vice Chair Holmes, Ranking Member Russo, and members of the House Health Committee. Thank you for the opportunity to provide proponent testimony for sub HB 248. My name is Schaef. I am a family nurse practitioner with 15 years healthcare experience, including 8 years in critical care. I would quickly like to respond to previous question in that this bill differentiates from our current exemptions because it expands exemptions to adults, which is very important to understand. I am here as a concerned citizen to advocate for bodily autonomy and freedom for all Ohioans. I would like to begin with facts regarding vaccine risk. From the CDC, no vaccine is actually 100% safe or effective. The National Childhood Vaccine Injury Act established a committee from the Institute of Medicine to review literature on vaccine reactions. This group concluded there are limitations in our knowledge of the risks associated with vaccines. Rare side effects and delayed reactions might not be evident until the vaccine is administered to millions of people. The federal government established the Vaccine Adverse Event Reporting System, VAERS, to monitor adverse events following vaccination. If it looks as though a vaccine might be causing a problem, the FDA and CDC will investigate further and take action if needed. Per the Health Resources and Services Administration, since inception of VAERS, 8,028 petitions were determined compensable, totaling approximately $4.5 billion. When a person suffers a life-altering injury, it does not matter how rare it may be. It is significant and it is life-altering. Vaccines given annually or frequently will have higher incidence of adverse effect. This is documented in VAERS. Over half of the compensated injury petitions were from influenza vaccine, 4,104. The second highest adverse effect had 1,273 compensations. Influenza vaccination by far had the highest number of injury claims and compensation. I know 3 women who were hospitalized within 2 weeks of a COVID-19 vaccine. One was admitted into critical care for a week. She was not ill for over a year during the pandemic until after receiving the vaccine. She recovered. Another was in critical care in a coma for over 6 weeks. She has survived, but she will never be the same. I cannot and will not ignore the significant risk that I am seeing with my own eyes. Per the CDC, there have been 4,647 reports of death related to COVID-19 vaccines. The same webpage states a review of these cases has not established a causal link to the vaccine. This leads me to question the credibility of the CDC. RotaShield was pulled off the market in '99 based on 15 VAERS reports in infants. But now we have over 4,600 reports of death after COVID vaccines, and it is immediately dismissed. What is happening? How is this happening? Rather than pausing, governmental agency has now expanded use to unstudied groups such as children and likely recommending a booster dose in the fall. This is absolutely unacceptable, and so is coercing someone to take a liability-free injection into their body. This evidence shows risk of adverse effect from COVID and flu vaccines up to death. Both vaccines have individual risk. What will happen if people take them at the same time or in close proximity? No one knows. No one knows. The Nuremberg Code prohibits that anyone be mandated to comply with this experiment. I have suggestions for how to address immunocompromised population in this scenario, but time does not allow, so please ask later if you would like to discuss those. To conclude, statutes hold that bodily integrity is preserved even after death. You cannot take organs from a deceased person without their expressed prior consent. If we preserve bodily integrity for the dead, then we must also afford this right to the living. All vaccines have inherent risk. We cannot force a vaccine to prevent a hypothetical illness when it has known documented risk of potentially irreversible adverse effects. We teach our children about body sovereignty and consent because their bodies are their own. It is incredibly invasive to require or force a vaccine. People should not be coerced into taking an invasive medical procedure in exchange to receive an education, to be gainfully employed, or to participate in society. As a human of any age, race, religion, or culture, one right transcends all labels, and that is the right to have control of our own bodies. Thank you for your time. Ohioans must have freedom and the right to bodily autonomy. Please vote yes on sub HB 248. Thank you, and I'm open to questions.
I'd like to start the questioning with Ranking Member Russo.
Thank you, Chair. Thank you so much for being here. So you talked about some of the adverse reactions to vaccines, which certainly can be very real. But my question for you, as someone who's in the healthcare profession, are you aware of any medication or medical procedure that does not have the potential for risk, that is entirely risk-free?
Chairman Lips, Ranking Member Russo, all medical products and all medical procedures have inherent risk. The importance of this bill is that most people are given free choice, and if they decline a recommended intervention, they're not discriminated against. There are no major consequences from that would affect them in an adverse way other than the consequences of their own decision. The situation with vaccines right now is very different. People are losing their jobs if they decline to get a flu vaccine, healthcare workers, and people may lose their job if they do not get an experimental COVID vaccine.
Follow up, please. So because you are in healthcare, what is your recommendation for an employer, such as a hospital, a medical office? These are settings where you've got very vulnerable patients coming in to seek treatment, and there is a responsibility of those organizations to protect those patients who are coming in from nosocomial infection, from contagious diseases. So what is your recommendation if they are not requiring their healthcare personnel, if they can't require their healthcare personnel to get a vaccination that would be protective against flu or COVID-19, or any number of infectious diseases that we have vaccines now available to you? What is your recommendation for how they should be protecting patients as well as their other employees?
Chairman Lips, Ranking Member Russo. I think that it is completely within an employer's right to make recommendations about what they think is best for their staff and for any of their clients or patients. I think that employers can provide a reasonable accommodation for people who are unable or unwilling to receive a vaccine. They do this already for disability, religion, any reason that an employee might need a reasonable accommodation. And so one of the ways I think this could be done in a hospital setting, because that is the most concerning area for risk of infection in vulnerable populations, is that they could, I believe, recommend the vaccine, and most healthcare workers will take these vaccines. They can screen patients that are coming in, and if they have certain comorbidities or if they're unable to be vaccinated because of an immunodeficiency or a previous immune reaction, then I believe that in most settings, a reasonable accommodation could include assigning a vaccinated healthcare worker with that patient.
So in that line of thinking, I mean, we hear from, through the chair to the witness, we hear from many healthcare organizations that they already face staffing shortages. In some areas, it could be nursing staffing, it could be any number of our allied healthcare professionals. So now we're asking them to reassign patients and healthcare providers based on the fact that that a healthcare worker won't take a vaccine and they're not able to require that as part of the employment. Much like, for example, there are some physical demands of some jobs in the healthcare profession that, meeting those physical demands of the profession are also a requirement. Am I understanding correctly that that's what you are suggesting?
Chairman Lips, Ranking Member Russo, it would not change the staffing assignment as far as numbers of patients. It would simply change how they were directed, which providers were taking care of which patients. So I don't believe that a staffing shortage would necessarily prohibit that accommodation from being able to be completed. And also, you brought up about requirements for a job as far as physical ability. While there is risk of injury with that, it's not an invasive procedure that threatens someone's bodily autonomy. And again, people are given a choice. The one other thing that I wanted to mention as far as employers and how to reduce that liability, I believe that many businesses are already having customers and clients sign waivers, releases of liability. I know when I take my children to the trampoline park, there's a COVID disclaimer that we will not hold them accountable if we get exposed to or get COVID while we're there. I think that hospitals could easily put such a waiver, a release of liability, into their permissions for treatment. And I think that many businesses will do that, not just hospitals. I think many businesses are already doing that, and they can, and if they want to, if they think that would be helpful, they should. And then customers can decide if they want to use those businesses or not. I mean, if you want to go skydiving, they make you sign a release of liability that you may get injured. You can't go if you don't sign it. I think that businesses want to be protected, and this is not something that a vaccine can control or prevent. The vaccines are not 100% effective in preventing this. And so I think that businesses would want this kind of liability exemption for all people, whether they are vaccinated or not. And in that way, it would not be discriminatory, and it would still protect the business.
I would like to refocus committee at this point. This bill doesn't expand exemptions. This is a bill about discrimination and freedom of choice. It's not about expanding exemptions. And to Ranking Member Russo's question about risk-free drugs, and the witness answered there are no risk-free drugs. However, vaccines are the only liability-free drugs. There are no other drugs exempted from liability except vaccines. So I want to make sure we understand the lane that we're operating in here. Let's proceed with Representative Gross.
Chairman Lips to Ms.
Schaef.
Schaef. Can you speak to me about perhaps some of the things you're seeing in the professional world with providers around you, whether they are nursing assistants, nurses, nurse practitioners, and physicians, as I know that many physicians, nurse practitioners, and nurses are afraid to speak out for their rights to be vaccinated. Can you speak to that regarding the shortages of staffing, and would it be possible that part of our shortage is exacerbated by the requirement to get the COVID vaccine and the flu vaccine, and that have you seen that healthcare providers have actually left the profession?
Chairman Lips, Representative Gross, thank you for your question. So I can actually speak to this personally, an experience that I've had on a previous job. And I have received vaccines in the past, and at a certain point I realized that I was having adverse effects from them. I have sent a personal narrative to all the members of this committee regarding my personal background and why this bill is important to me, so I did not elaborate on that today, but you have that in an email. And so at a point, I've received many vaccines in my life through childhood, through my nursing program, and when I was working. After receiving several flu shots, I developed some nonspecific autoimmunity. And I decided that I did not want to get flu shots anymore while I was investigating my health problems. So the employer that I worked with, at one point, when they knew I was not getting my flu vaccine, they told me I had to wear a mask, which I complied with. And when I asked my manager what I should say to my patients about why I was wearing a mask and other people were not, she responded that I should tell my patient that I was sick. I just had a little cold, and I was wearing my mask to protect them. I didn't agree to do that. I worked in a perioperative setting. I would not come to work sick to take care of patients before surgery. So on further discussion, I was instructed to tell my patients that I was wearing my mask to protect them and to protect me because I did not take a flu shot. Well, that violates my privacy immediately. For a while, I was very direct with my responses, as I was told to be. And there were points that conversations started with other staff, and sometimes even with patients. They would ask me why I didn't take a flu vaccine. And usually my response, pretty typically, would be, I've decided based on my personal health issues that the risk is not worth the benefit, and so I'm not taking one that year. I started to get harassed at my place of employment. After working there for 9 years and really having no track record of any kind of disciplinary action, I started to be disciplined for everything. If I was 1 minute late for work, they pulled the previous 6 months, and any time that I was 1 minute late, they documented it and had me sign. At one point, I had another staff member tell me not to disclose who it came from, but that she was instructed basically to watch me, and if she had any concerns with other patients or conversations with staff, that she should report it. When I went to my manager and I addressed it, and I said, I just wanted to ask, other than my punctuality, do you have any concerns about my performance? Her response was not yet. Freudian slip, I guess. Her response was not yet. I said, oh, are you expecting to? She said, oh, no. I ended up resigning from that position after 9 years because I had a funeral for extended family on a Saturday that I was scheduled to work. I knew the policy specifically stated it was for immediate family only that you were allowed bereavement. I called and I resigned over the telephone because I felt very strongly that I would be fired if I called off to go to that funeral. And after working there for 9 years and never being terminated from any job, I did not want that on my record. So I've personally experienced that type of discrimination, that type of pressure, that discomfort for trying to do what's best for myself. And I think that's all I have to say about that experience. I mean, yes, there's a shortage because, partly because the environment is made so uncomfortable that people leave the profession entirely. And I personally could not work in a setting where they required a vaccine because it would make me physically sick. It has. I don't need science to tell me if it could. I know that it has. And so there's really not many places that I could work, even with the shortage, because they would try to require me to have a vaccine.
Representative Liston.
Thank you, Chairman, and thank you for your testimony. I just wanted to talk a little bit more about maybe the reasonable accommodations that I know Rep. Russo had brought up. I guess, you'd mentioned that in a healthcare setting, if there are unvaccinated workers, then there could be changes within, who cares for whom. And my concern, though, is that this bill actually says that an employer cannot ask or require an individual, or request, and it actually even says request on line 12, request an individual to disclose the individual's vaccine status. And then further down, it says that they're not able to ask the individual to do anything or not do anything related to the vaccine status. So as you mentioned, right now, hospitals, for those who choose not to get the flu vaccine, they're requested to wear masks to decrease transmission. And I know that you'd sort of made some suggestions on how, with this bill, healthcare settings could make adjustments, but I just can't see how they could do it if they're not allowed to ask or ask them to do something different related to vaccine status. Clearly you have very personal experience with it. How would you rectify those things?
Chairman Lips, Representative Liston, thank you for bringing up that language of the bill. I think that points out actually that it's kind of a moot point that maybe we don't even need to discuss, because if the employer can't ask, they could simply use a waiver of liability, and then it protects the staff from their privacy being violated. It protects the staff from discrimination, and it still allows patients and clients to get the care by simply releasing them of liability related to certain vaccine-related illnesses, such as like flu or COVID right now, are the two vaccines that are likely to be required on an annual basis.
But it doesn't protect their health, right? The patients would still have a higher risk of exposure to flu or COVID, and simply signing the liability away doesn't change that.
Potentially. It's not something that I think that we could quantify. I mean, again, in society, you don't know who's around you is vaccinated for what conditions. So potentially, it may not prevent every infection, but vaccines do not prevent every infection either. They're not 100% effective. So my point was to make that employers could use certain pathways to decrease their liability. There's always going to be a risk for an infection in any environment, and we typically in healthcare take additional accommodations for anyone that's greater at risk, such as gloves, gowns, masks, sanitizing, cleaning their rooms more frequently, isolating them. So there are a lot of other things in place that have been used in the past to still protect people that are vulnerable.
When they're infected, but protecting them from the healthcare providers. We don't glove, gown, mask for every patient, and every patient who's hospitalized is at higher risk of complication.
Every patient that's hospitalized may be at risk of an infection, but we couldn't determine if they'd be at risk from a complication. They could get an infection and develop natural immunity.
But the fact that they're hospitalized indicates they have a current vulnerability. I have a second line of questions, so I just want to be respectful and pause if we want to, I can be circled back around because the second line of questions is a little bit different. So I'll either continue or...
Okay, we'll put you on second round of questioning. Representative Gross, representatives, anyone else who has not questioned this witness? So on a second round of questioning, Representative Gross.
Chairman Lips to Ms. Schaef. Yesterday, I met a children's hospital nurse. I won't say which one because I'll get in trouble. She's afraid. She's been told by this hospital not to speak. She's very afraid that she will be pressured. She's already pressured. She doesn't care. She gets her flu shot. Do you believe that your experience is isolated? I know you probably don't have the numbers in front of you, but are you the only nurse practitioner in Ohio who has had this experience, or do you have some pro-vaccine and maybe non-vaccinated providers who have also been discriminated against, or do you believe you are the only one?
Chairman Lips, Representative Gross, I know for a fact I'm not the only one. I know of people who have been terminated for not participating in the seasonal flu vaccine, regardless of their reason why. And so I know I'm not the only one.
Representative Liston.
Thank you. That was quick. So I wanted to talk about the self-reporting, the VAERS system. And a couple of questions. I'll start just with, you mentioned, this was the 80s, late 80s, when rotavirus was pulled from the market because there was concerns, and I think it was a single-digit number of potential incidences of intussusception, but there was concern, and it was evaluated, and so it was pulled. And similarly, I think we all saw when there was the 5 or so incidences of the potential blood clot, the J&J vaccine COVID was pulled and reevaluated. So, with the VAERS system, which is, self-reporting of events after a vaccine, not necessarily related, what's your thinking around the reasoning of why vaccines wouldn't be pulled if there really were thousands of people that are having deaths associated with the vaccine?
Chairman Lips, Representative Liston. It's a great question. And it makes no sense to me that there would be over 4,600 reports of death linked to a vaccine. And while it's still being studied, they would make a statement that there's zero correlation, zero causation related to any of those vaccines. It just does not make sense to me. I cannot make sense of it, that a vaccine would be pulled for 15 events of something that may possibly cause death, but did not necessarily cause death. And while I know that this is reporting database, that's a large number for us to still be giving this. And I still support people's right to choose to take this product, absolutely. But the notion of requiring this in order to work or go to school or to go to any public place is just completely unacceptable to me until we get more information. And even when we do have more information, there will still be inherent risk. And so my stance would still be that people should deserve the right to choose.
So to delve into that number a little bit more, though, these are people that died after receiving the vaccine, any cause, right? So there's been about 158 million people across the United States that have received a dose of the vaccine. Mm-hmm. If any of them die, right, they're reported into the system, regardless of cause of death, mm-hmm. right? So on average, about 8,000 people die each day. Mm-hmm. So if you think each day 8,000 people die, 150, half of our population has received a dose, at least a dose of the vaccine. It seems reasonable to think that the investigation done may have found that these are deaths that simply occurred. It's a time frame thing, not a causality, right? Because a death occurred after a vaccine, mm-hmm. and it was investigated and not found to be due to the vaccine, that to me seems like a normal finding with the number of people you usually expect to die every day. Half of the people, right? Half the people that die every day have already received the vaccine, right? If half the population has received the vaccine, and thus would be a part of this database if it were reported, right? So if you're hit by a car, if you die from lung cancer, it's part of these 4,600 people. Yeah?
May I respond?
Yeah.
Chairman Lips, Representative Liston. I do not believe that there's been any vaccine in the history of VAERS that has had this number of reports of adverse events and death. I completely acknowledge that we do not have enough information. We really need these cases to be evaluated more comprehensively to determine if there could be any actual causation, because there's a possibility that there could be some causation. We can't automatically rule out that none of them are correlated.
But I guess I would say that the CDC has said they've investigated it and have found that they're not. So when we see
I don't trust the CDC, and that is a huge number. I mean, really, for 15 cases, we pulled a vaccine. Now we have
Right.
4,600 reports of death. Even if one of them, I mean, that should cause pause, and we're not getting transparency. And so really, like if any of those were correlated with that vaccine, then I think we should be pausing both to get more information about the vaccine before we roll it out to untested people, like children and elderly people who were not in the initial studies, and also before we require it or mandate it, potentially in any setting.
So what sort of, like the J&J was pulled because they found that association. And so what's the difference here?
So I guess I would really need to pull the data on where the numbers fall on the other cases, because certainly not all 4,600 adverse events of death were linked to the Johnson & Johnson vaccine. So that can be pulled through VAERS, and I would be happy to try to get more information to help to look at that data if you would like for me to do that. I do not have that with me today.
Okay. Again, I would submit it's been looked at and doesn't need individual people necessarily when every expert group has concluded this. But
I would disagree. That information is available on VAERS, that people can actually pull and see the adverse events. I mean, some of these adverse events are within hours to days of the vaccine, and people that are otherwise healthy with no comorbidities, with no underlying health issues, that are young, that would not be likely to die.
So I guess it comes down to a disbelief in what those who evaluated the data concluded. Sort of a...
I do not believe that the current information that I presented today has been completely vetted for accuracy.
Okay, thank you.
So I would like to have more information regarding those data points.
Okay, thank you.
Committee, thank you very much. I have 5 questions, but we're simply out of time. We've had 30 minutes on this round of questioning. We still have 5 professional or executive or expert witnesses that traveled from out of state, so we're going to have to move on. I will add and just say that one perplexing issue that we just ended with is 4,900 deaths. A representative tried to explain that, saying, but that could be natural deaths or deaths for some other cause. There was recent protests and rallies across the United States, and the claim was one death is too many, one life is too many, and all of a sudden 4,900 divided by 2, well, that's okay, and then 3 of them died of this, and there's been more than one death. Why wasn't it okay last summer? But now it's okay because it's a vaccine. I'm just saying. So excuse me for getting off track. Ms. Schaef, thank you very much.
And if
Again, I'll remind the audience to please do not comment. Ms. Schaef, thank you. We certainly didn't intend for you to stand there that long. You get overtime pay.
Chairman Lutz, thank you for the opportunity, and if you have any additional questions for me later, please feel free to reach out. Thank you very much.
Thank you.